Hi guys! Today's training is on the ABA basic vocabulary or terminology that we utilize. This is typically one that we do in our very first parent meeting, and we do it just to kind of give you a general idea of what the terminology that we regularly use means. You'll see a lot of these terms in your daily progress notes and things like that. So I am just going to go over it just in case you are continuing to watch the other videos. So then that way it just kind of helps you prepare and make yourself familiar with some of these terms. So the first term is a reinforcer. So this is a stimulus that increases the frequency of the response it follows. That's a pretty wordy term there, but really what we're looking at is something that we utilize to help provide reinforcement for a child. So this is typically some of their highly preferred things that they really like. And that reinforcement is actually a whole nother training. So you'll be able to dig deeper into that one to understand better what that is. So there's a reinforcer, which is the actual item we're delivering. And there's also reinforcement, which is like the basic general concept of delivering a reinforcer, which is the preferred item, based on the response that we want to see increased. So if we are looking to increase communication skills, a child, the scenario would be that the child says ball and we give them access to the ball. And in that scenario, looking at the antecedent, which is the motivation for the ball, the response is asking for the ball, and the consequence is receiving the ball. That ABC contingency is an example of reinforcement. And the ball in that scenario is the reinforcer that we're providing contingent on the response that we're looking for. VB-MAPP. So this is the standard assessment tool that we utilize for evaluations. So you may hear this term a lot. It stands for Verbal Behavioral Milestones Assessment Placement Program. And basically what it is a language-based tool to evaluate where a child's skill sets are as in relation to their chronological age. So it's broken down into 3 levels. There's level 1 that corresponds to 0 to 18 months of age developmentally. Level 2 corresponds to 18 to 30 months of age, and level 3 corresponds to 30 to 48 months of age. So it's just kind of a general guideline for us that we utilize for our kids. It's not a blanket evaluation that we use for all kids. It just kind of depends on, of course, their age, because as you probably just heard, developmentally it caps out at 4. So if you have a 12-year-old, then we would utilize a more age-appropriate assessment tool. The term program or lesson is something that you would often hear, and it's a specific thing that we're working on to target a skill that we're looking for. So an example may be that, we're teaching a child to communicate their wants and needs better using words. So we would put a program or a lesson in place that would specifically target requesting with one word. So that whole comprehensive program would be placed in your child's program binder. So that's one of the several goals that we would be working on. And within that program, there'd be specific targets. So we would pinpoint specific things that we would be working on within that program to make up what we need for your child to achieve those goals. So an example may be that we want your child to request for 10 different things. So maybe they're really good at saying cookie, but that's the only one word that they utilize to request what they need and want. So our job would be to look at What else are they motivated for in teaching them the word for open or close or apple? Whatever it is that is their highly preferred, going back to the term reinforcer, to kind of establish that as a part of their program. With the overall goal of identifying 10 specific different things that they ask for. Each of those different things that we target. So say we're working on open and close. Those two things would be called targets. The next thing is a prompt. So a prompt is something that we utilize to facilitate a correct response. So again, there's a whole nother training on prompting. But basically it is some type of guidance that we provide to help encourage the correct response. So an example might be, if we say touch your nose and the child doesn't do anything, we may provide a physical prompt for them to touch their nose, and then we would provide them access to a reinforcer to show them, when we say touch nose, this is what we're looking for type deal. Mastery criteria. So this is also something that you'll readily see on your daily progress notes. Each child's mastery criteria is a little bit different, and we kind of go based on how quickly they learn, which we call their acquisition rate. So our blanket one that we typically start with is 80% across 3 days. So we take very specific and formal data. So we're able to see all right, now this child really knows how to touch their nose when we say touch nose without any prompting. So now they may have achieved 80%. Which if they did it, 8 times independently out of the 10 that we presented, then that's day 1. And then we want them to show us that they can do that the next day too. So again, depending on your child, some kids don't respond well to, doing something 3 days in a row, 10 times, they know it, boom, move on. And those are the types of kids that we modify mastery criterion for. Some kids struggle with retention of skills, so 3 days might be enough, maybe, or not enough. Maybe by day 4, if we're not teaching it anymore and running it 10 times a day, they might not still be getting it. Then we would extend the mastery criteria a little bit. So that would be individualized to your child based on the skills that they have. You may hear the term session or shift. That is typically the allotted time that somebody is scheduled to work with your child. So our half-day kids, say they're 9 to 12, Monday through Friday, that would typically be 1 shift for your child per day. If your child is has a full day schedule, maybe they come 9 to 4, then we would likely break it down into a morning shift and an afternoon shift, which would likely be 2 different technicians. This really helps foster generalization of teaching across different people. And it also kind of helps prevent burnout from your child. If you're hearing you're one-on-one, and if you're hearing the same person provide instructions all day long, it might become frustrating to your child. So we generally break it up to shifts for that reason, to help foster generalization. And generalization is our next term. And that basically just means that your child is transferring skills from one thing to another. So in our teaching, we start with general teaching. So you have that one technician who's teaching these skills. And then we work on making sure that they transfer. So we want to make sure that they transfer to various people. So hence the reason for having more than one technician, because we want to make sure that these skills are transferring. And, it's really great that they can do these things for Tiffany. But then when mom goes to ask these things, the child has no idea what mom's asking. So we want to make sure that, it's transferring from one person to another. Also environments. So especially because we're clinic-based, we want to ensure that the skills that we're teaching are transferring to the home, and also to the community and to school, especially behavior challenges. So if we're implementing a specific behavior plan, we want to make sure that whatever we're doing is consistent at home and across the other environments as well. Across instructions, so you may hear us consistently say the same word or phrase to get the child to attend to our instruction. So for example, if we're teaching a child to identify their body parts, we may start with touch nose, and then we say touch nose every single time, which we know is not natural, but it helps us contrive the situation to where we're able to control, we want the child to attend to what we're saying. And however they learn is going to be how we're going to teach. So if they're consistent with understanding that touch means, okay, I do this to my nose, and when I say touch head, they do this to their head, then we're going to work to vary that and teach generalization. So find your nose, where's your head, show me your nose. So then that way we're varying what we're saying, we're varying our intonation to help facilitate that generalization as well. Novel examples is another piece of generalization that we teach. We call it multiple exemplars. So when we're teaching, say, to identify a ball, we might say touch ball, and then have the child touch the ball that we have with us that we are teaching with. And then we would work on making sure that they can identify several different types of balls, because cool that they can identify it at the table in a structured environment with the blue small ball, but they can't necessarily do it with a red giant bouncy ball that's also a ball. So those are some examples of ways that we teach generalization as well. And again, it's individualized. So if your child naturally learns with rotating instructions and materials and things like that, then we would start like that, because it's more natural. Not all kids do. So we kind of just learn that as we go, and when each program is done, we test for generalization. And if we're not seeing that, then we teach it, and we continue to teach it until we're transferring it to all of those specific components. And SD, so that's something, again, you might hear come from a tech or from me, and an SD is the same thing as an instruction. So it's exactly what we're saying to the child to respond in the way that we want them to respond to. So if I said touch nose is my SD because it's the instruction that I provided. Natural environment teaching. You may hear this a lot from me. Oftentimes when a child starts with us, we start teaching in NET, or natural environment teaching. And we do that because it's more natural than the opposite, which is discrete trial teaching. That's structured teaching at a table with consistent instructions and materials and eliminated distractions. So we typically start with NET, and if a child is too distracted or is not successful, or I feel like their acquisition rate could be better if they're sitting and attending better, then we would go the discrete trial teaching route with them. ABC, so that's our antecedent behavior consequence. We talked about that a little bit with talking about like antecedents and consequences. So antecedent is the A, and that's something that comes before the behavior. B stands for behavior, and that's the behavior of interest that we're looking at. And then C is consequence, and that is what happens directly after the behavior. Again, there's another more comprehensive training on that, so I just kind of wanted to talk about what that stands for. We also have maintenance. So maintenance is something that's embedded into each child's program, and again, individualized based on your child's retention of skills. So this maintenance is just making sure that your child's maintaining the skills that we've already taught them. So when a full program is mastered and we generalize, and yes, the child can identify various examples of cows, with different instructions in different environments, then we would move it to maintenance. And we would test it, however much is needed for that child, once a week, once a month, every other day, to make sure that they still have that skill, basically, to ensure that they're not losing any skills that we've previously taught. And then the last component I wanted to talk about, or a couple terms that I wanted to familiarize you with, are some of our terms from the VB map. Like I said, it's a very common assessment tool that we utilize, and we have very unique terminology that's embedded into that assessment tool. The first word is mand. So a mand is basically a request. So in the previous example, I said, child asks for ball and then receives access to the ball. That's an example of a mand, because your child is requesting for the ball. Tact is another common one that you'll hear, and that's basically a fancy word for labeling. So in that scenario with the ball, we might hold up the ball and say, "What's this?" And the child says ball. That would be an example of a tact, because they're not asking for it, they're labeling what it is. Intraverbal, that is basically a fancy word for like a reciprocal conversational type skill. So I might say, "What's something that you can bounce?" And the child says ball. That's an example of an intraverbal, because they don't see anything. They don't want the ball. They're not labeling the ball, but they're answering the question that we asked them. So that's like your who, what, where questions that you're asking, and the child's responding in some way. And basically it's like I said, the reciprocal conversational type skills. And then listener responding is the last one that I feel like is relevant for you to know. You may have also heard it as receptive language, and that is any time a child is responding to a spoken instruction. So if I said, "Touch your nose," then that right there is a listener responding skill, because it requires the child to listen to what I'm saying and perform the correct action. So it's basically any of those instruction following type skills. Also, that encompasses identifying items. So where's the ball? But there's also a fork and a bowl around. It requires the child to again attend to the instruction and perform the right action and choose the correct item. So those are some examples of some listener responding skills. And that is it for the ABA Basics vocabulary. Like I said before, most of these have their own individualized training, so you can learn more about those by looking through the rest of the trainings. Thanks, guys.